I'm recording, and my battery's low, so I need you to not make no noise and go away. Hey guys, welcome to my channel. Hope everybody's having a wonderful day. I hope all is well. Thank you so much for watching. I want to talk today about PRN nursing, working in healthcare facilities as a PRN nurse. I'm not sure how other facilities work their PRN staff, but I want to give you my experience working at my facility that I work at as a PRN nurse. As you guys know, I'm back home in Alabama, and while I'm here, I'm working a little bit. I've been back working for about 2 weeks now, and last week I was on the schedule for 2 days. The first day I worked, it was an 8-hour shift, and I worked like 6 hours. I think I got sent home early the first day, and then the second day I was on the schedule, I got called out completely. So, PRN is as needed. So, yeah, I got called out. My husband, he's funny. He doesn't work in healthcare, so he doesn't really know the ins and outs and how things work, and he don't understand it. But he said, "Tell them, don't wait so late next time to call you and let you know you're not working, and tell them to call somebody else out instead of you." And I just kind of laughed. I'm like, "That's not how it works." And so she called me. Actually, I had gotten up. I'm scheduled to work like at 5:30 in the morning. So I got up about 4 something, about 4, maybe 4:15. And I was completely dressed and actually about to leave the house when I got the text the second day and said that they didn't need me. I didn't need to come in. So that's what he was a little perturbed about, that um, we both had gotten up, and because it's dark outside, and we park our vehicles outside, so he gets up with me because it's still dark out, and he makes sure I get in the car. So he didn't like the fact that we both got up and I was completely dressed, and then they called and told me not to come. But I told him, I didn't mind. I was glad that she called me before I wasted my time driving all the way into work and then getting called out, or working just a few hours and then getting sent home. So, I appreciate that. Call me, let me know before I get there, right? So anyway, he was like, "Yeah, tell them to call somebody else out." So I had to explain to him that a lot of times they don't know what their need will be until the day of or that morning. They have to come in and look at the census and look at staffing and look what their needs are. And if they don't need me, since I'm PRN, I'm the first one that they'll call off. Yeah, and since he's not in healthcare, he don't really understand that. Like I said, I don't mind because that's what I signed up for. I knew that when I decided to work PRN, that it would be on an as need basis, and that means when the hospital needs me, not when I need it. So yeah, I'm all right with that. So yeah, anyway, first week I worked a little and got sent home early, and then the second day of that week I got called out, and then this week, in this week I'm on a schedule 3 days. So yesterday I worked and I worked a full shift, but today I got sent home early again. So that's how it is. It is what it is, right? As a PRN person, so I know sometimes PRN people, they get mad. If they get called off, or if they get sent home early or anything like that. But we just have to remember that we are as needed. That means that we work when the hospital needs us. So if you are dependent on a certain amount of hours and you need those hours, then you make sure you don't go PRN, because you never know. You're not guaranteed any hours. So the full-time staff is priority. So they will work first. They will call if the census is low. PRNs, we're the first ones that call off, or we get sent home early. And I knew that, signing up, I know that that's what, as PRNs, that's how it is. We work as needed. So again, if you need your hours, um, you know, PRN staff are not guaranteed hours. So yeah, don't go PRN if you need your hours. So don't get mad. I mean, that's what you signed up for, right? Um, you signed up to work as needed, not according to your needs, but according to hospital needs. That's just business. That's hospital business. So I've been working as a nurse for a long time, and I've also seen and experienced PRN staff who they just want to work when they want to work. They don't want to work holidays. They'll take off before a holiday, the day after a holiday, a week of the holiday, or in the summer months they don't want to work. They'll take off, weeks at a time. Um, yeah, they just want to work when they want to work, even if the hospital needs them. And before I got into management, I kind of agreed with the PRN people when they said, I don't want to work holidays, or I don't want to work during the summer. That's why I'm PRN. I only want to work when I want to work. And I was like, yeah, that's why they're PRN. They don't want to work full-time hours, and they don't want to be here all the time, and they have the opportunity to just work as needed, but it's not, as needed according to their needs. It's supposed to be as needed according to the hospital needs. Um, yeah, sometimes they feel like since they don't get any benefits, they don't get any insurance, no earned time off, they don't accrue any ETO, so they don't get any earned time off. They don't get any contributions to their retirement, 401k, or whatever retirement plan the hospital offers. So the hospital don't put any money towards that, or whatever, if it's not a hospital, whatever healthcare facility it may be. Since they're not getting any benefits, they feel like they're entitled to just work when they want to work, and take off whenever. But that's not really how it's supposed to be. That's not how that works. It is really, really hard as a charge nurse or manager trying to do your staffing, especially around the holidays, summer months. People are, full-time staff taking off, taking vacation, and then all your PRN people, they don't want to work. Then you're short. You're short staff, and that is not fun. It's really hard to it's really hard to staff when you got PRN people on your books and none of them want to work around the holidays, or summer months, whatever. So as a matter of fact, at my facility, it got really bad. We were really getting slammed around those holidays and summertime when all the PRNs were taken off. They changed the policy, and now PRN people are required to work a certain amount of weekends, holidays, weeks. They can't take off, for a long period of time without approval. So in that policy, as it should be, it needed to be changed, because it was really hurting the units as a whole when PRN people do that. So I made this video. I wanted to talk about this topic because, I just want to remind PRN people, or, if you're a PRN person, I'm a PRN person. As a matter of fact, because I'm PRN occasional, I don't even get the shift the differential pay that they give most PRN people, because I only work occasionally. So I'm PRN and I don't even get that. So even though you're not getting any benefits, you still are getting compensated by the differential pay that they give PRN people. Like I said, I don't get it because I'm PRN occasional, but most PRN people, they get a little bit more money because they don't get any benefits. So anyway, if you are a PRN person, please keep that in mind, that we work as needed, as the hospital needs us, and not as what our needs are. And just also, remember that managers, they have to keep an eye on their budget. It's their job to keep costs down and keep their budget under control. So if the census is low, then first people they're going to call off is PRN people. First people they're going to send home is PRN people. So if you you need that money, then don't go PRN. I guess that's the truth of the matter. As managers or charge nurses, they can't just let us sit on that clock. They can't let PRN people ride the clock. If there's nothing for us to do, they're going to send us home. So maybe some nurses don't know that, or they forgot that, or whatever. But yeah, um, if you didn't realize that was how it was going to be, then probably instead of working PRN, just look for a full-time or a part-time position, because yeah, they're not going to just let us sit and ride the clock. They're going to send us home. So tell me, how is it at your facility? How do they work their PRN people? I'd like to know. So leave me a comment. And until next time, guys, have a blessed day. Bye.